Hey, Dr. Wieters, I just saw a patient. I was going to present it to you. Alright, here it is. So I'm dealing with Mr. Bates. He's a 55-year-old male, and his chief complaint is chest pain. He has a past medical history significant for GERD, depression, anxiety. In his childhood, he had his tonsils and adenoids removed. He had a hernia repair at a young age. It's about 10 years ago. Socially, he drinks alcohol occasionally, about once a month at a special party. He lives with his family. He's married and has 3 children. He's a banker in town and has been employed by the same employer for the past 23 years. He eats a lot of fast food in his past medical history and social history. Family history: his father has a history of lupus. His mother has a history of anxiety. His paternal grandfather had skin cancer. His HPI, he says that his chest pain is sharp and is located in his chest region, and he says that it doesn't radiate. He says that he's been having it for 1 week. He's had a couple of episodes. He had one at home. He had one while he was at a movie, sitting down at a movie. The next one happened when he was at his sister's house when he was sitting down. And then the next one happened when he was at the bank just sitting there reading the newspaper at a break. He says the severity, when the nurse wrote it down, it was 9 out of 10 severity scale, out of 10 being the worst. He said that he took some Tums to try and alleviate the pain, and one time it made it better. And he says that he felt kind of anxious once when the pain happened. On review of systems, he's got no fever, no sore throat. He's chipping and scaling of the nail, more close to the medial nail bed of the 4th right toe, so that should be noted. But the rest of his foot hygiene seemed to be intact. I didn't see any lesions. He seemed to have good hair along his anterior tibial area and no signs of chronic edema and stasis. So my differential diagnosis for this patient would be, since he has a history of depression and anxiety, and he said that he felt anxious, I think the chest pain may be anxiety. My next consideration may be that because he said that Tums made it feel better and eats fast food and drinks alcohol once a month, that this might be reflux, and so I think that's high up on the differential as well. And then when I was pressing on his chest, I remembered when I touched the left 4th sternoclavicular region, he had some pain, so I think it might be more costochondritis maybe. So his EKG was normal, we looked at that, and I think if his x-ray is normal, he's probably going to go home because it sounds pretty much like a nothing.